Have you heard people online talking about LDN, low-dose naltrexone, for chronic pain, fatigue, or autoimmune conditions? There's a lot of excitement about this topic, but also a lot of confusion. In this video, you'll learn what naltrexone and LDN are, how LDN may work, what conditions it's most often used for, potential side effects and drug interactions, and key safety points to discuss with your healthcare team. Naltrexone is a medication that blocks opioid receptors in the body. In standard doses, typically 50 milligrams daily, it is FDA approved to support treatment of opioid use disorder and alcohol use disorder as part of a broader recovery program. Low dose naltrexone, or LDN, uses much smaller doses, commonly in the range of about 1 to 5 milligrams per day. Important. When LDN is used for issues like chronic pain, inflammation, or autoimmune symptoms, that is generally considered off label use. LDN is often described as paradoxical because it's the same medication, but at a very different dose, so the effects may differ. There are two main proposed mechanisms. LDN may briefly block opioid receptors. The theory is that the body may respond by increasing its own natural opioid signaling, often described as endorphins after that brief blockade wears off. This is one proposed explanation for why some people report improvements in pain, mood, or well being. Another line of research suggests LDN may influence inflammatory signaling in the nervous system, often discussed in relation to microglia and toll like receptor 4, TLR4 pathways. A practical takeaway: LDN is generally discussed as immune modulating, not immune suppressing, meaning it is not typically described as making someone immunocompromised the way certain immunosuppressant drugs can. LDN is most often considered when symptoms may involve chronic inflammation, immune dysregulation, and/or central sensitization. Areas with more clinical research interest include fibromyalgia, inflammatory bowel disease, multiple sclerosis and other neuroinflammatory conditions, certain chronic pain syndromes, including neuropathic pain in some contexts. Some researchers are exploring LDN for conditions such as chronic fatigue syndrome and long COVID, but this remains an active research area. If pain is mainly driven by direct structural tissue damage, for example, some forms of osteoarthritis, LDN may be less effective compared with conditions driven more by nervous system sensitization or immune signaling. People who respond to LDN often describe improvements such as reduced pain, volume, less widespread sensitivity, improved sleep quality, better fatigue tolerance, improved quality of life. However, response is variable. A fair expectation is it may take several weeks to notice change, it may require careful dose adjustment with a prescriber, and some people do not respond, even when it's used appropriately. LDN is often described as having a generally tolerable side effect profile in many reports, but side effects can still happen. Commonly reported with LDN: vivid dreams or sleep disruption, insomnia, headache, mild GI upset. A common clinical strategy only under clinician guidance is changing the timing. For example, morning dosing, if sleep disturbance occurs. At standard doses, naltrexone includes warnings about potential liver injury at excessive doses and is generally contraindicated in acute hepatitis or liver failure. Because naltrexone blocks opioid receptors, taking it alongside opioid pain medicines, for example, morphine, codeine, tramadol, can reduce or completely block opioid pain relief. If you are taking low dose naltrexone, inform your surgeon, anesthesia team in advance so they can plan pain control safely. Always check with your own clinician before starting, stopping, or changing any medication. This is for general education only and is not personal medical advice. If you're looking for more functional medicine education and practical health insights, subscribe and hit the notification bell so you'll be the first to know when a new video is out.